So far, the Provincial COVID-19 Task Force Committee have recorded 9 COVID-19 related deaths in the last 3 weeks. This figure is of those who were isolated at the isolation center alone. The number of health workers infected is close to 15% of the total workforce at WHPHA. The PHA's Director Medical Services, Dr. Jonah Kuripi, said with an increased number of frontliners being infected, it is appropriate for them to be vaccinated sooner so that they can be protected to provide healthcare services to the public.
Trend is increasing as there's a surge in the transmission within the province. We had a central province and we have a large population who is mobile on day-to-day basis. All our health promotion activities, our health prevention measures information have not been followed to date, and this brings to our service we are running in a situation where we will not have enough numbers to maintain the service.
The hospital is in dire need of assistance. There are not enough staff to maintain healthcare services, while drugs and medical consumables are limited, and the hospital is likely to scale down remaining services. 3 weeks ago, they scaled down the outpatient clinic and elective surgeries due to financial constraints. The hospital also had to convert the surgical ward into an isolation ward to cater for COVID-19 patients. It is an added burden they have to deal with.
Over the last 2 weeks, but we are seeing that we cannot cope up the stress that is coming forward to us. It is compounding the existing situation when we continue not to have enough or sufficient or available basic medical drugs and consumables. This pressure is also adding up to the situation. The only thing that we are waiting for is the vaccine.
The provincial hospital is also in dire need of Gene Experts cartridges and COVID-19 testing kits to confirm cases in the province and do follow-ups. Director Nursing Services Sister Janet Yamo said there are a lot of aging nurses who were supposed to retire but are still working, and if the province is under siege due to the virus, it possesses a greater risk to the hospital.
So, because we did not have the Gene Expert cartridges, our samples were sent to Brisbane and Singapore, and that turnaround time was about 3 weeks. So within these 3 weeks, we told the patients that they were negative. But after the 3 weeks, when the results came back, we noticed that they were positive. So not much of contact tracing and information was given out. So we feel that that is the area that we need to strengthen.
The hospital is expected to receive its first doses of vaccines this Friday. More than 600 frontline health workers and their partners have given names for vaccination. Vasanatha Yama, National EMTV News, Mount Hagen.